today we're here with Dr. Chris Butler, and remind me the name of your practice.
Butler Family Health Center.
I like that, a family health center. So you take care of people from birth to old age?
Yep.
It's that family practitioner.
Yeah.
I like that. Oh, I appreciate you being with us today. I had a wonderful pre-talk with you. I'm fascinated with a little bit of your history, but why chiropractic and some of the philosophy behind that. So if you don't mind, I'd like to explore that a little bit more.
Sure.
All right, great. So first of all, tell me a little bit about you. You have a practice here in the Denver area?
Yeah, I've been here for 15 years.
Nice.
I've been practicing for 20. So,
Where'd you practice prior to Colorado?
I was in Arizona for a few years.
Too hot down there.
Yeah, that's why I came here.
Yeah.
Exactly.
It's a beautiful area. Although here, hopefully you find a little more active outdoor people. Does that change who you see in your practice compared to Arizona?
I see pretty much everybody.
Pretty much everywhere?
Yeah.
Yeah.
I see lots of different kinds of things, which is good. It's fun.
What attracted you to chiropractic? As a professional man, educated, I'm sure you had lots of career choices. Why chiropractic?
Well, when I was in college, I was about 20, and I was doing a lot of triathlons and a lot of studying, and I thought I was going to be a business major, or I thought I was going to be a doctor, like a medical doctor.
Yeah.
Because I was interested in helping people. Like, I wanted to find a cure for cancer, really, was what my plan was. Because I was like, well, I could do this. I mean, if they work on something really hard for like 10 years, I believe that they can figure it out.
Yeah, immerse yourself in.
But I was young, 20, naive, thinking that this is, real. So, I know that's true, but in our reality it changes. Anyway, so that was my plan. But then I started having a lot of back pain, so I went to a chiropractor, and I didn't know what to think. I wasn't into, I don't believe in taking medicine, like drugs and stuff, to cover stuff up, and I was that way then. I don't know where I got it from. I don't know if that's innate or what, because I didn't get it from my family, but, they were kind of medically oriented. So anyway, I didn't know what was going to help. So I stumbled in somehow, met this guy, the chiropractor at Delhi, and at lunch or something. And he's like, "Hey, you should come and see me." So I did, and he helped. It saved me. It was like he took a knife out of my back by the time he was done. So that was it. And I decided I was going to be a chiropractor then.
Right then and there.
Yeah.
Where'd you go to school?
So I had to finish up college and get what I needed, and then I went to Cleveland Chiropractic College in Kansas City.
So from what I can tell, I think you probably research things pretty fully. You tend to really...
I overdo it.
I like that. It makes you an investigator.
Yeah, my dad said I should be a research doctor. That's what he was thinking.
And it's wonderful to have in a practitioner, because I don't
Yeah.
think you probably accept no as an answer on anything.
No.
No. So why the school that you went to?
Because I thought they were the best at teaching the technique of being a chiropractor, like the adjustment part.
The adjustment. So
It's
you got
true.
lots of clinical hours in there.
Yeah, and they did have a good program. So yeah, they make some great chiropractors there. So that's why I wanted to go there.
So, you had a chiropractor. What did you learn beyond there? So it was about relieving pain. I think a lot of people think of chiropractic as I just go to get rid of pain. But I think you probably see patients that go far beyond, because chiropractic, as I've studied it in history, actually started off as more of a medical profession than I think many people now perceive it to be.
It's been pigeonholed over the past 20 years of health insurance and stuff into like back pain care, but it's really not. It's way more than that. It's about removing interference to the nerve system so that we can enhance function neurologically, so that the body can heal itself, because it knows how to do all this stuff innately, right? And innately, nobody had to teach you how to increase your heart rate when you're running.
Mm-hmm.
That's innate stuff. Our nerve system knows how to do that. And for it to work at the absolute best it can, like for it to be able to eliminate cold and flu and disease and other things, or to maximize its ability to deal with those things, the best way to do that is by removing interference to that system, you see. And that's what chiropractic is. What a chiropractor does is a good one. What they do is they detect and remove that interference, right?
So that interference.
So we're just a tool or like a vessel to help get that done, right?
Yeah. You've learned
If you're
how to
doing it
read the
right.
body
Yeah.
and palpate and know. Because sometimes I may have an issue going on in some area of the body that could be related to where I've turned off the nervous system.
Mm-hmm.
So can you give us an example?
Got interfered with somehow. Like one example would be a patient comes in with, doc, I have numbness in these fingers here
Mhm.
on
You
this
hear
part
that
of
a
my
lot.
hand, you know, and if you go to well, I'll stick to what I do, which is chiropractic. But if they come in with this, 95 times out of 100, it's being caused by C5 nerve right here, okay, or C6.
Coming out of the
which
neck.
finger it is. It's very specific. C5 controls this, C6 controls this, C7's here, okay? So if this one's getting pinched, that's C6. We just go here and look, right?
You know, it's interesting. I'm thinking about other modalities because to me they're all related. I mean, when we take a look at it, what we explore with our channel is that interrelationship. So I know that in some modalities, this pinky finger is related to the heart. Do you find that when you find, so if I think about this finger related to a particular cervical.
Pinky is more like C7, C8. As far as heart goes, there's overlaps, you know,
Right.
with autonomic nerve system, sympathetic nerve flow. You've got, you know, the autonomics is the part that controls the heart and the lungs and that kind of thing. And that does have branches that there's overlaps.
Right.
And some of those do go through
And I have
C8.
seen the charts where they show
Yeah,
the nerve tree
dermatomally.
coming out.
That's classic neurology. That's what they teach the neurologists. That's this stuff. Neurology 101 is C5, C6, C7. You know, so if they're looking here for the problem, they're not going to find it. They should go here because this is where the nerve system is, and that's where we always find it. It's that way with carpal tunnel cases too. Most of the time, it's coming from here, or there may be a blockage here at the wrist level, which is causing the median nerve to get pinched. So one of the things I do is I specialize in treating those wrist bones because there's 2 rows of floor here.
Mm-hmm.
They can cause blockage. You fix that, you fix the problem. It's not that hard.
So you have a particular way that you approach the patient in order to identify root cause.
Hmm?
Do
Yeah,
you?
not effect. Yeah, we're going after the cause.
We're going after cause.
Yeah.
You know, we hear so much. I love the fact that you're a family practice. I know that many people may come for themselves as an adult. You know, I'm the adult, I'm watching, I'm making those choices. But do you see many children, and what kinds of things?
I see a
Because
lot of
kids,
kids.
you tend to not find that they're complaining about aches and pains. They're kind of bouncing off the wall. But I'm bringing my child because they have attention deficit disorder, or they're starting to show signs of blood sugar issues. I mean, we have a growing obesity problem in our country. with young
ADD can be
children.
caused by problems with neck energy flow and stuff like that, interference there. Or, you know, of course there's a lot of diet problems with that, like sugar and that kind of thing. But, yeah.
So do you help me as a parent explore some of those so that I can look for alternative ways of dealing with the
Yeah,
global
definitely.
diagnosis that we often give?
yeah. I think just getting the spine in line helps most things, you know, and then see where, if you get the spine in line, it allows the body to heal itself or manage itself as good as it can. And so then you just sit back and watch what happens, and that's usually good.
That is good.
Yeah.
So you're working with that inner way of knowing. I know
Mhm.
a lot of things can relate to, so you've talked about cervical, but
Well,
you
one
know,
thing about kids is, if a kid's ever complaining about pain, or headaches, or back pain, or neck pain, or something, it's, to me, that's a red flag. That's bigger than if an adult's complaining about it, because kids, this is a fact, kids don't feel pain the same way adults do.
that makes
And
sense, because we only
as you-
feel pain in
Yeah,
high beta,
They
right?
just have a higher pain tolerance,
Yeah,
and because the nerves aren't there yet.
yeah.
They're
Or the brain
growing.
not, the whole forebrain
Yeah,
hasn't
it's
fully
not,
developed.
it's not quite done yet.
Especially if
So-
you're below age 7, right?
Hmm. So the connections just, they don't feel stuff. That's why if you're a kid and you're on the playground and you fall and you bang your shin really hard on a beam, you know, you can go, and you get up and go again, you know?
Yeah.
An adult, if I did that, I'd be down for, you know, a few minutes. It would hurt,
Yeah.
you know? But they just bounce right up and keep going. It's because they don't feel pain the same way. So if a kid's complaining about pain, I always say you should get them in.
Get them
You know,
in.
yeah, headaches or neck pain or back pain, that means something's not right. You know?
Do you see a lot of birth trauma with infants?
Yeah, we do.
So do we maybe start them out
Yeah,
coming into the world?
It's good for them. I mean, the most traumatic thing a baby can do is go through the birth canal with the way that, a lot of times, the way that the doctors pull on them and stuff. That's pretty traumatic. What we do in my office is to correct and fix those things that happen from that, and a lot of times it does need to be corrected, is we use like gentle techniques. It's like one finger, it's like this, you know.
'Cause
And
it's
you
all it
find a
takes to
specific
move.
spot and you just move it a little
Yeah.
bit. It's like a millimeter. It's nothing traumatic. It's not like, I can't even watch those videos about, you know, how the doctors bring a baby in.
Yeah,
It's tough.
yep. We,
It's like
we
watching-
don't birth naturally in this country, I
I
know
have
that.
a hard time watching football where they're hitting each other because I know too much about what's going on in there in slow motion. You know, when I see them hit their neck and stuff, like, man, he's gonna feel that later. You know, in a
Yeah.
few years, that's gonna be a problem.
So the sooner I can get in, I think probably the better. So if somebody's had, so if you had advice to give somebody who's exploring chiropractic, it's better to use that sooner than later. Pay attention to what's going on with the kids, because
Yeah,
doesn't the body learn new pathways if you let that trauma stay there?
yeah, it does actually, and it holds the stuff too.
So
Holds trauma.
it's more work for you to unwind that and get them back to the
It's
natural
true.
state.
Yeah. Yeah.
Well, thank you. Why, so any area of specialty that you see within your practice? I know that everybody is gifted and it sounds like you're a gifted chiropractor overall, but you tend to find that there's an area where your patients are referring and you're seeing a growing number of your patients for particular reasons?
There's a few things that I do that I seem to gravitate towards, and I'm not sure why exactly, but you know, one of them is pregnant women.
Oh, that's nice. So
Yeah.
you're able to help them with the lower back. I remember
Mm-hmm.
when I was pregnant and I went to a chiropractor regularly because, you know, your whole body's doing
Yeah, and
different
you
and I
don't-
had the lower
You
back
don't
pain.
want to take pills for
Right,
back pain, but
right.
most women do have back pain when they're pregnant. So they just, a lot of times they'll just suffer through if they don't know a chiropractor, a good chiropractor. I've seen hundreds of pregnant women in the office over the years, and it helps them. It just flat out helps them. And there's nothing bad about that at all. If women are asking, can you adjust pregnant women? Yeah, they need it.
And it's probably
It's
going to
not-
ease the whole birth
should
because if
be-
I can have that whole area relaxed,
It
I'm
should
going
be
to birth easier.
mandatory, because yeah,
Yes.
because you know you enhance nerve system functions. The baby's getting what it needs. A lot of times, if a baby's breech, we can get it to turn just by doing adjustments here, because the baby's not getting a signal from the mom's nerve system to turn when they're supposed to, because they got some kind of blockage in the low back.
Yep, because it's all one system at that point.
You can ask pretty much any chiropractor. We've all done that before.
So that's wonderful.
Yeah.
How about besides pregnant moms? See a lot. You see their babies as a.
Yeah, we see the little ones, but I was trying to figure out why I see some. I think it's because I'm the oldest of 7. And my mom's back hurt all the time when I was growing up because she was always pregnant, and so I'm real good with pregnant women because I've been around them a lot in my life, you know. And, you know, I used to have to. She'd want me to rub her back and stuff, you know, when I was growing up because her back hurt, you know.
Yeah.
And I didn't think about that till just a few years ago. I'm like, maybe that's why I'm natural ease there.
Yeah.
Yeah.
Thanks for joining us.